So I'll talk a little bit now about lymphedema in oncology. So it was something a little new to me. So I knew about oncology physio because that's kind of how I wanted to get into everything. Lymphedema was something that I've never heard of really before. And it's something that can be a side effect of, your chemo treatments and the surgery as well. So it's something that I think it's really overlooked, but it's definitely up and coming. And it's something that's chronic and long-term that a lot of people don't get managed in time, and they end up with kind of debilitating issues from it. So lymphedema is basically a condition where there's an excessive accumulation of this fluid in your tissue. So right underneath your skin is your lymphatic system. And it basically has a mixture of protein and water in it. Then the lymphatic system kind of maintains that ratio of water in your body. If there's something that happens to your lymphatic system, then that can alter that kind of nice flow of fluid in the body. So you can end up with the accumulation of it. And basically that can happen for a few reasons. It can happen because you've had lymph nodes removed. So if you've had cancer treatment, say, I work a lot with breast cancer, and if you have an axillary lymph node clearance, which is basically they take pretty much all the lymph nodes out of your armpit, if there's any cancer detected, any of them, if they take those all out, your entire arm could swell up because that area is actually controlling that level of fluid. It can happen anywhere in the body. So I see a lot of head and neck cancers where they have a neck dissection and they end up with lymphedema really of their jaw and their face through their neck, and just working to help get rid of that or help teach them self-management strategies. There's also lymphedema of the legs as well. So any sort of gynae cancers, prostate, ovarian, if they have to remove lymph nodes around the groin area, you can end up with excessive swelling of the legs. And also the lymphatic system works with your immune system as well. So it gets away if you have any infection or anything, it kind of destroys those pathogens and helps get rid of that infection, takes all the waste products out of your tissues and out of your body. It works alongside your cardiovascular system. So it's a really complex area to kind of be in. It's nothing you can't do anything surgically with it. You can't take any medications for it. So really the main treatments is compression therapy, exercise, and you can do some massage to help relieve some of that swelling as well. And so you can also have primary lymphedema. So that's completely not related to cancer. And then you can have that secondary, which happens afterwards. If lymphedema is untreated, what can happen is that it can continue to grow. So if you type in lymphedema into Google, you'll see these massive legs, and then the other one's about this big. And that's just what can happen if it's left untreated. So there's a huge population out in rural areas that don't have access to treatments like this, that have those kind of conditions where you can't really do too much at that point, which is kind of why I wanted to get in what I get into, so I can help, stop that and, give access to people who need it. And so this is kind of different areas, again, like I was talking about, all the different types of cancers that can affect the lymphatic system. Now, I work with pretty much all of these. So it's not just breast cancer. I work with sarcomas. I work with end-stage cancers. I work with lung cancers. So I go anywhere from initial diagnosis all the way up to palliative care, where they're kind of at the terminal stage. And it really makes you kind of think clinically what aspect of their journey they're on and what they need in that time period. So kind of tailoring your physio and tailoring your approach to things. And then each one is different. So, breast cancer is extremely different than if you had had a neck cancer. So it's something that's constantly keeping me on my toes, and you have to really just continuously learn about it. I think in the sense of what we think or what I think physios can do for it, again, this is lymphedema, and that's kind of what we do for lymphedema, like I was talking about. So looking at exercise and movement, compression therapy. So I probably have a lot of compression stuff here, but we fit and measure for compression stuff, help people get it on, help them manage their own condition. But I think a large component is the exercise aspect to it. So we have group classes where you do exercise with them. You get people moving and rehabbing knees, ankles, anything like that, that helps get that fluid moving. And that's kind of the holistic approach that we take to it. So physio, exercise, rehab, there's a lot more that I think we can do as well. So in regards to breast cancer, I do a lot of shoulder rehabs, frozen shoulders or any sort of trauma that happens extensively through some of the surgeries where person's unable to move their arm a certain way, they have to get back to work. So you still get a little bit of that musculoskeletal aspect where you're rehabbing a lot. But then you also kind of get a little bit of everything. So I have to know lots about cardiovascular and how certain chemos affect certain systems and what to kind of know about what's the contraindications. And then doing a lot of actual referrals to other services as needed. And then there's a lot of contraindications as well. So if they have things like bone metastases through their spine, you can't do certain twisting motions. And so just allowing people and giving people exercises that they can do safely that helps build up their strength without doing any damage. And just realistically, I think the main thing I take is just how to improve somebody's quality of life while they're going through this, and just giving them, that ability to do it themselves, and they're feeling really empowered, and they're feeling. A lot of people say that that's just kind of what gives them the motivation to keep going, is the fact that they can exercise, and they're, if they exercise with other people going through the same thing, they have that network. And so it's like a really interesting part of my job is helping facilitate that as well. So I work pretty much in 2 different locations. I'm in a private practice right now that does lymphedema, but we do mainly lymphedema that comes from venous issues. So any sort of vein going on, any sort of heart problems that causes swelling. And then I work 3 days at a cancer hospital as well. So it's called Chris O'Brien Lifehouse, and it's basically a supportive oncology center, which has doctors, it has all its cancer treatments, but then we're in a little area of it that has a supportive care doctor that does, actually is highly researching a lot about medical cannabis and end-stage palliative care. We have nurses, there's yoga therapists, there's exercise physiologists, nutritionists, psychologists. So it's a very multidisciplinary team. So we kind of all work together to have this holistic approach to helping. And yeah, so that's kind of what I do. It's interesting how I got there. I knew somebody, one of my friends from uni, her mom was actually the doctor that works there. So when I was in uni and I kind of knew this is what I wanted to do, I was actually able to volunteer there. So I just reached out and said, I'm really interested in this. Can I come and learn a little bit more? And then was able to volunteer when I had a few weeks off. And then that's kind of how it all stemmed from there. So if there's an area that you're really interested in, I recommend just reaching out to as many people as you can and just letting them know that you're really interested. People love to teach and they love to show what they do if they're really passionate about it. And that kind of was what sparked my interest in this. And then after the volunteer, I just kept working and eventually got the job here. So which is very lucky. And so that's kind of the reason I stayed in Australia. I was debating between going back and got this opportunity. So I'll stay out here for a few more years and get that experience that I want to get and then transfer it back to Canada when I go back.